Okay. What about you? You were in all the workshops.
This state which was passed down from the generation to generations, which the body would have been
But is it necessarily genetic? Myosin? No. Can you have acquired myosin? Infections. You know, according to Hahnemann, myosins are infections. Why they can be deep? Why they can be obstacles? Because infections can go deep into our organism and change our organism. They can create susceptibilities. They can create susceptibilities to serious chronic conditions. And also, infections can go from one generation to the next generation. You know that about just 9% of our genome, of our DNA, codes for our own proteins. About 91% of the DNA was believed to be junk DNA. But new researchers show that most of those junk DNAs are the sequences of DNA that codes for viruses. This means that there are lots of information about viruses in our own DNA. Why?
because we are viruses.
Yes, somehow. Why? You need some reason, evolutionary reason. You know, many viruses are capable to insert their DNA into our genome. Even normal viruses, for example, the herpes labialis, blisters, or even varicella zoster. They can insert their DNA into our own DNA and use the machinery of our cell to produce their own DNA. When they insert their DNA, they can be cured. And if they infect our germinal cells, they can be transmitted to the next generation. It's very simple reasoning. What is it interesting to know that many of these old infections were very useful for us. Recent research has shown that during implantation of the fertilized ovule in the uterus, some viruses are activated or appear in the site of the implantation. Isn't it interesting? Some viruses appear in the site of implantation of fertilized ovule. Why? Because I told you there are many viruses, virus codes in our DNA. Many are important according to evolutionary concepts. When the mammals were formed during evolution, some of these infections, some of these retroviruses that infected that were epidemic during those era, millions, billions years ago, they inserted their genomes, their DNA into human, not human, in the basic organism genomes. And some of those inserted DNAs change the organisms. Mammals are indebted to some viral infections of their ancestors. It's interesting to know that some of those viruses that are called HERVs, human endogenous retroviruses, are activated during implantation of ovule. So for having a child, you need the activation of those viruses. We are all working together. We are somehow got used to thinking at some parts of the universe as our enemies. We say that we want to get rid of that chronic condition, chronic disease. If you know that the chronic disease is a solution, is an optimization of the defects, you do not say that I need to get rid of that. I should understand that what has formed that optimization. So, somehow I can solve the problem with looking deeper into the case and change that optimization level. And so, move toward a better condition. Not always optimals are good conditions, but are the best that can happen now. So, organisms are like this. We look at all microorganisms like our enemies, but there are always interactions between the microorganisms, viruses, and multicellular organisms. So I will go through it with the cases, with case analysis and case works that you have during the class, because I think that you need to work and solve cases to understand the concept. But to summarize this slide with a pragmatic view, when a case, you have a case taking from the patient that comes into your office, you should consider all these chronic hazards in the case. You see that are there make causes, or some defects, or some irreversible defects in the case, or do you have dynamic chronic patterns? What types of dynamic chronic patterns do you have? Non-infectious, non-infectious, or infectious? The homeopathic prescription should be done according to dynamic chronic patterns. So what is to be cured, according to third authority of Ardavan, is a dynamic chronic pattern. If a Parkinson's disease patient comes into your office and you see the case, you see, for example, those static chronic patterns because of the destruction of substantia nigra in the brain of the patient, you do not consider those symptoms. So you prune symptoms related to the Parkinsonism. So what is the dynamic chronic pattern? That deep dynamism that caused the destruction of substantia nigra. You can trace the symptoms or signs of those dynamic patterns by seeing the timeline of the patient. What were the symptoms? What were the change of the symptoms of the patient prior to development of Parkinson's disease symptoms? If you pay attention to those symptoms, then you can have the symptoms related to dynamic patterns. Okay, I think there is a pause now. Okay.